And every day is a gift, and many of us forget that. We get so busy in our activities of daily living, going to work, going to the grocery store, picking up the kids. And so many times we get so caught up in what we're doing, we forget to be where we are at that moment. And that's a really, really important life lesson. We forget to be in the moment. And the gift is really being in the present. And sometimes that gift is when you're present with the patient and they're going through treatment and they're scared. It's stopping, it's sitting down, maybe holding their hand, maybe letting them know that they're not alone on this journey, and letting them know that you were truly there with them, because it's really an important gift that you can give. And so there is a gift of cancer. You may not realize it, and for some survivors, they don't get the fact that cancer is an opportunity to be a gift, but you have to learn to see it as so. But it reminds each of us that we're only guaranteed this moment. And you shouldn't have to go through adversity, and you shouldn't have to go through cancer to understand this. But we as care providers have to understand this as we treat our patients. Because if we can shift our perspective, we can help our patients shift their perspective as well. So cancer is an important lesson. Do you know what feng shui is? It's called clearing the clutter. And I took feng shui to a whole different level. I got sick of living in the clutter because when you live in clutter, you can't seem to find things you need, so you waste time. And because I'm trying to be more present in the moment, I got this big giant dumpster. I can tell you it was humongous. Put it outside my house, and I started clearing the clutter. My husband likes to save things. I'm not going to call him a pack rat, but he just doesn't know what you're going to need in the future. And, I'm not the kind of person that keeps clothing that don't fit, because, I don't want to have those jeans hanging in my closet from high school, because I don't need to be reminded that I used to wear them. So they went to Goodwill. But when you learn to clear the clutter in your life, you allow yourself to have openings for other things that are really important to you. I will give one word of advice. If you're going to clear the clutter in your kids' rooms, get somebody else to oversee it, because you don't want to have that adversarial reaction. I had someone come in with my kids. Her name was Extreme Christine, and she came in and did an extreme clearing of clutter of my boys' rooms. I could have never gotten that much crap out of my house without her help. So, I've learned to use my better judgment. You have to let go of people that don't honor you. And this is a gift of cancer, because a lot of us keep people in our lives that fail to honor us. And why do we do that? I don't know. Probably because you think it's easier than getting rid of them. But people that don't honor who you are don't need to be in your life. Balance. It's an important one. I've had multiple opportunities for improvement in my life when it comes to balance. It's not a little box that sits in your cupboard in your kitchen that you can go grab a box of balance and suddenly be there. It's something that you have to create. And if any of you watch The Shining, all work and no play makes Jack a dull boy. We all know what happened to him. If you don't take time to balance work and play and self-care, you can't empower your patients to do that either. And for some of us, we work and work and work and work and work, and you go home and you say, where is everybody? Well, nobody's home waiting for you, because they're busy living their lives, being in the moment while you're working. So really think about creating that balance, and think about empowering your patients to do so as well. Because cancer will stop people in their tracks, and no longer is their paycheck and their job the most important things in their lives, because they're realizing that they need to be with their families and living in the moment. And you might want to know, how did a surgeon learn to live in the moment? Well, clearly, in the operating room, I'm quite focused when I'm operating. But I had some opportunities for improvement, because when I was a general surgeon and I'd be in the OR, the ER is calling. There's a patient with a hot appendix, or there's a patient with a perfed ulcer. And I had to realize that I could only be at one place at one time. And if I wasn't completely present with that patient, I wasn't doing them the best service that I could possibly do. So my nurses, who I adore, put me in timeout. And they made me go to the corner of the room and said, listen, get back here and get focused. You can't change what's happening in the ER. You can't change what's happening at your house. You can't change all those things. But what you can change is being present and focused in that moment, and then moving on to the next thing that you have to do. And my lesson for learning about being focused and present in the moment came from my girlfriend, Christine O'Donnell. And Chris is an amazing orthopedic surgeon. And she, at the age of 42, was skiing double diamonds in Colorado, or somewhere awesome out west. And she called me and said, I had this problem with, I couldn't lift my ski up. And so she noticed she had a foot drop. And within 6 months, she was in a wheelchair, having been diagnosed with Lou Gehrig's disease. And ALS is a really crappy disease. It's as crappy as cancer. It may be even crappier. I went through this process with my girlfriend, learning that I could not make her better. And there's nothing that makes a physician, particularly a surgeon, feel more hopeless and helpless than not being able to cure someone that you love and care about. And what Chris taught me on the journey, she taught me about healing. She taught me that I may not be able to heal or to cure each and every person that walks into my life, but that I could empower them to heal. And between her and my other colleague who was diagnosed with a brain cancer, I became very aware that there was something way bigger than what Western medicine had to offer our patients, and that all I had to do was open my mind to it, and I would be able to help my patients to learn these life lessons. So we have to prioritize. And the most important thing for a patient is educating them about what their choices are and creating a healthcare team. And I tell my patients all the time, if you don't like the physicians or care providers that you're with, you need to vote with your feet and walk out the door. There are plenty of care providers, and you cannot be treated in a facility or by people who you don't feel connected with. And we cannot be the impersonal care. We can't just say, hey, listen, I'm going to give you a couple rads of radiation and send you on your way. If the patients don't feel as though you're invested in their cure and healing process, they don't need to be in your practice. Patients need to get their care in a timely fashion. And sometimes this is difficult because, their life gets in the way, and, sometimes I have to stop my patients and say, listen, who's the most important person in the world? If you don't stop and take the time to get your therapies now, you may not be here to worry about the things that you're running away from. And so timely care is another really important factor in caring for cancer. Clinical trials. As X-ray techs and radiation therapy technologists, you need to also know that a lot of times our patients may be fearful of clinical trials because they want to know, am I getting exactly what everybody else gets? And clinical trials can be tough because we want our patients to participate in them so that we can stay on the cutting edge of Western medicine. But sometimes being on a trial is fearful because they want to know, am I getting the right thing or am I getting the wrong thing? And being able to reassure them and understand that patients on trials need a little bit of extra something sometimes because they don't know if they made the right choice. And sometimes they just need the reassurance that we wouldn't have put them on a clinical trial if we didn't believe that we were giving two of the best options out there. And that sometimes down the line, we figure out that one was better than the other, but that they were able to help other people in the future as well to get great care. Patients need to finish their therapies. I've had some patients come back and try to barter and say, do I really have to go back for that boost? I'm like, I almost want them to sign a contract up front and say, yes, I will get my boost. And, or I will come back for my final treatments. Because it's very difficult sometimes for them through the process. They get tired, they get anxious, they just want to be done. And one of the most important things that I think we can educate our patients about is integrating healing therapies. And I'm not talking about alternative medicine. I'm talking about complementary therapies. I'm talking about things that enhance and complement what we do in Western medicine. And here's the thing that you guys, whether you know it or not, you're seeing the patients very much when they're on the cliff. And this is the part where the medical oncologist said to me, well, how did you figure out the cliff? And I said, well, I paid attention to my patients because they're not really scared as much during their treatment. It's when their treatment is done. And for many of my patients, the treatment ends with you guys. It ends in radiation therapy. It ends when they've just finished their last radiation treatment. And they walk out, and we like to think they're going to feel liberated and happy and kind of giddy. But they're not, because they hit the cliff. So here's the cliff. It's 2 weeks after the final treatment, whether it's surgery, radiation, or chemo. And for many of my patients, it's radiation therapy. And that's why it's so important for you to understand the cliff. Sometimes the reconstructive surgery doesn't seem, because they've already been on the process, it doesn't seem like such a big deal because they already have gone through the loss of sometimes their breast and the reconstruction. But the cliff is really important, and that's when I bring patients back to my office. And it's usually 2 weeks after their final treatment because sometimes it takes time to get into that mode.